The following instructions are important following a wisdom teeth removal. Discomfort can be normal after the removal of teeth. Pain medication will be prescribed, and it is advised that you take a pain medication on the first day. If you are not allergic or intolerant to non-steroidal anti-inflammatory drugs, you may start taking Advil or Motrin. If Advil or Motrin doesn't control your discomfort, take the prescribed narcotic in addition. It is recommended that you alternate between the narcotic and Advil or Motrin. Do not take them at the same time. Be certain to take your pain medication with food, as this will help prevent an upset stomach. Remember, narcotic pain medication will impair your judgment and reflexes, so do not drive or operate heavy machinery. Typically, minors will not be prescribed narcotics, as over-the-counter pain medications are effective for these procedures. A small amount of bleeding is common for the first few days. Gauze pads should be placed directly over the surgical sites and held in place with firm biting pressure for 30 to 45 minutes. Be sure to position the gauze behind the existing teeth, as biting on the gauze with your teeth will not control bleeding. Replace the gauze pads every 30 to 45 minutes. The amount of bleeding will vary from person to person. The gauze pads will always appear red. The way to assess bleeding is to directly look at the sites after the gauze pads are removed. Swelling can be normal after surgery. Keep your head elevated with 1 to 2 pillows for the first 3 to 4 days. Do not lie flat. Swelling can be reduced by applying an ice pack to the side of your face for 20 minutes on and 20 minutes off. Continue icing the face as much as possible for the first 24 to 36 hours. Do not apply ice directly to the skin. These measures may not eliminate swelling, but they will help reduce its severity. Pudding, jello, applesauce, yogurt, ice cream, and smoothies are excellent options for the day of the procedure. Always cool down any hot foods or liquids during the first 24 hours. You should eat only soft foods for the first week, like scrambled eggs, mashed potatoes, macaroni and cheese, soft fish, and steamed vegetables. Do not use a straw or spit for the first week after the surgery. Avoid hard, crunchy, or very chewy foods until the site is fully healed and you are pain-free. It is important to keep the areas really clean to avoid infection or delayed healing. Begin brushing your teeth on the day of surgery. It is important to brush all of your teeth, even if the teeth and gums are sensitive. Avoid the surgical sites on the day of surgery. On the next day, gently brush over the surgical sites with almost no pressure. You may remove some stitches, which is fine. Brush around the packing if one has been placed. Do not rinse on the day of the surgery, as it may prolong your bleeding. When rinsing, please be mindful not to spit. If a mouth rinse was prescribed, start using it the next morning and twice per day. Warm saltwater rinses can be made by mixing a half a teaspoon of salt in a cup of warm water and should be used at least 4 to 5 times a day, especially after meals. If you have been given an irrigating syringe, start irrigation on the 3rd day following surgery. Fill the syringe with warm salt water and place the tip of the syringe into the extraction site to clean. Do this 3 to 4 times a day after meals for the first 2 weeks, or as directed. It is helpful to look in a mirror at first so that you can visualize where to aim the syringe. Do not smoke for at least a week. Smoking will increase your bleeding, the possibility of dry socket, and will also delay the healing process. For the first 3 days prior to using the syringe, you can keep the sites clean by gently brushing over the areas. No strenuous activity for 3 to 4 days following your surgery. Avoid bending over, heavy lifting, or straining. Physical activity increases your blood pressure, which will cause an increase in your swelling, pain, and bleeding. You may gradually increase your activity after 3 to 4 days. Low-impact activities such as swimming may be more comfortable at first. Thank you for taking the time to watch these post-operative instructions and following them carefully.